reimbursement, the various parts of Medicare, fraud, abuse, different types of payers, and more. Risk adjustment scores are directly tied to the reimbursement providers will receive from beneficiaries. So if you see the word beneficiaries, it's the same thing as enrollees, or the same thing as people who have a specific insurance plan. So instead of us saying the patients who have this plan, we'll probably say enrollees of this plan or beneficiaries of this plan. So risk adjustment coding practices. Risk adjustment focuses on diagnosis coding using the ICD-10 code set. So you have your ICD-10 book. If you don't have it, you should have it on the way. ICD-10 stands for International Classification of Diseases, the 10th revision. That book has every single diagnosis that a person can be diagnosed with, whether it's toe fungus, to a heart attack, to a transplant, to a triple bypass. Now this is a procedure. Like I said, to toe fungus, to COVID-19, a heart attack, kidney disease, any kind of diagnosis, whatever the doctor says that could be wrong with you, it's in that book. Each October the 1st, there is a new version of the book that comes out every year. As we know, things in healthcare changes all the time, primarily every day. There are new codes that are added to the book. There are new codes that are deleted from the book, and there are new codes that are sometimes revised. The best example that I can give you, 2018, when we were coding in 2018, never heard of COVID-19. It wasn't even around, wasn't a diagnosis, anything of that nature. Well, by the time the 2019 ICD-10 book came out, we had heard of the diagnosis COVID. COVID was running rampant everywhere. So when they printed the new version of the book for that new year, they had to add the COVID-19 diagnosis code to that book. So just to show you a little glimpse of the book, and also if you have that app as well, you can also put it in the app. And I also want to get you used to using your book. So I want you to turn to the code U as in umbrella 07.1. U 07.1. Now, of course, your book is in alphabetic order, A, B, C, D, E, F, G. So you're going to go to the U's. And on the tab on the side, it tells you the section. Like the E section, that's for your endocrine and metabolic diseases. Your C section is for your neoplasm or your cancers. Your I category is your circulatory and your heart and your vascular issues. F is for like mental health and substance abuse and things like that. So you'll get to know it once you get to flipping through your book. So everybody see that U07.1, you see that COVID-19? New code that was added in 2019. So that's why it's also very important to have the most updated books as well, because there are codes. And if you're not going to have the most updated book, make sure you look online to find what the new codes are for that year so you can write them down in your book. Again, new codes come out every year. So again, risk adjustment practices focus primarily on or solely on diagnosis coding with this orange book. This is the only book we'll learn from, and that's the only book you'll need when you're taking your exam. Risk adjustment diagnoses are reported from claims and medical record documentation in all settings, inpatient, outpatient. We know inpatient is when you get admitted to the hospital. Outpatient is you're just going to see the doctor, going to a doctor's appointment, or maybe an outpatient one-day surgery. CRCs, which are certified risk adjustment coders, may work for health plans, work for providers, or they may work in other healthcare entities. Code updates and insurance payment policies may change as often as each quarter. Therefore, coders require continuing education to keep abreast of the changes. The number of CEUs that you have to have every 2 years would depend on how many certifications that you hold. The more certifications that you hold, the more CEUs that you would need. So first, we'll talk about this and we'll reiterate it, and I might skip it as we go to it, but I want to first start off by saying or telling you what is risk adjustment. Risk adjustment is so popular and is so much in demand these days because healthcare as we know it is changing. We used to be primarily focused on what we call fee for service, which means every time you have a service with a provider, then there is a fee. For an example, if you go to the doctor for a headache on a Monday, you're going to pay that doctor whether you're paying out of your pocket or whether you're using your insurance, but it costs you a fee if you go to the doctor for your headache on Monday. If you go again on Tuesday because your head is still hurting, there's still a fee. They're not going to say, well, you know what, you came yesterday, so we're going to not worry about it because you spent money with us yesterday. No, fee for service, which means anytime you're getting a service, there is a fee. So think about this too with the changes of healthcare. If healthcare was driven from fee for service, then that means doctors are worried more about quantity, getting them in and out, I'm trying to hurry up and see you. I'm trying to clock these dollars. They're more worried about quantity of patients because every time I see a patient, there's a fee. So I need to get them in. I need to see them. And they was not focusing on the quality of the healthcare, of the health of the patient, of the health status. So that's where risk adjustment comes in. Risk adjustment says, whoa, wait a minute. You just got this person to come to your office every day this week. You haven't solved their problem. They're still coming in paying. You just driven by the money. So we need to come up with a system that's more so focused on the quality of care and not the quantity of it. So with risk adjustment, again, focusing on the quality, that's why they call it value-based care or quality care, because they're focused on the quality. So now with the incorporation of risk adjustment, it's not so much driven by a fee-for-service model. It's driven by the risk adjustment model, which primarily says that if this person is under the risk adjustment model, that means that they have a few chronic conditions that has to be managed. And if they have chronic conditions that has to be managed, then that means they're going to be going to the doctor quite frequently if they have a lot of things wrong with them. And we're not going to be paying every time they run to the doctor because it's going to be a lot. So what risk adjustment does is anybody who is under a risk adjustment plan, that plan pays once a month. So that's why it's important for us coders to capture all of the codes that we see in the chart, because these codes translate into money. The sicker these patients are, the more money that these providers are receiving monthly for these patients, if that makes sense. So that's why they're looking for a lot of specifically risk adjustment coders who specializes in chronic conditions, because they know what they're looking for in these charts. These codes hold weight. These patients under the risk adjustment model get to what we call a risk adjustment score. The higher your score, the sicker the person is. The lower their score, the healthier they are. This has been able to stop a lot of fraud from Medicare and Medicaid. And it also saves money for insurance companies, and they help them know how to predict how much money they're going to spend per patient. Let me give you another great example. So again, like I said, each patient is going to receive a risk-adjusted score. The higher the score, the sicker they are. The score comes from these diagnosis codes that we're using. Now, we don't have to know chronic kidney disease weighs a 0.2 or heart failure weighs a 0.5. We don't have to know how much it weighs. The computer system does that. We just need to know we just need to know how to capture those codes so the computer can weigh in the score. Now, it's a good to know. If you do know those things, it's impressive, but it's not a need to know where you need to remember how much each diagnosis is weighed. Also, there are a lot of things that you're going to learn in this course. There's a lot of things you're going to learn with coding. Reserve your brain power for what's actually needed. So when I mean by reserve your brain power, a lot of things people try to remember when you don't have to. Remember the things that you need to remember. Everything else can be looked up. It can be wrote down. research or whatever. So reserve some of your brain power for what's actually needed. Okay. So another way that risk adjustment combats fraud is this very, very clever model that they came up with. So let's say that this person in their medical chart, that they don't have a lot of diagnosis, they're not sick, their risk adjustment score is right at the baseline. Usually the baseline is a 1.0 or a 1.1. That's the baseline that shows that this is a fairly healthy patient. Again, the higher the score, the sicker they are. So if I am an auditor and I'm auditing a patient's chart and I see that their score is a 1.2, which means this is a healthy patient. Their score is low, their risk adjustment score is low. So if I have a fairly healthy patient in front of me as I'm auditing their medical record, then why do I have all these EKGs? Why do they have these ECGs? Why do they have all these biopsies? Why are they seeing all these specialists? What's in the chart does not reflect these diagnostic testing and these things that you're charging for this patient. So are you committing fraud? Are you just doing these things for this patient just